Hello, good morning. I am Dr. Bishash. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, I'm Oliver Twist, 75 years.
Okay, Mr. How can I address you?
You can tell me Oliver.
Okay, Mr. Oliver, I have got letter from your GP saying that you have some blistering rash over your body for last 2 weeks. Is it right?
Yes, doctor, it's right.
So I am going to take detailed history and all the information during our discussion will be remain confidential. Is that okay for you?
Yes, doctor.
So can you please tell me in your own word what is happening with you?
Well, doctor, actually, it's for the last 15 days, I think. I have been having some problem in my skin. I think there is some rash. So I haven't had this type of rash before. It's more in my thighs and sometimes in my tummy region as well. Actually, I have never noticed this type of tense rash. Actually, this rash is very much tense and also itchy. Okay, so uh, I feel very much discomfort with this type of rash, and you know that I also have some problem with my tummy. I have been suffering from some bleeding from my tummy region while having my bowel motion. So that's another issue I have been worried about. But now this rash is really taking heavy toll on me.
So to hear that. And can you tell me that where did you notice first?
I think I first noticed in my tummy region.
Okay. And can you describe the rash for me? How does it look
Uh,
like?
I think, doctor, it's some fluid filled, some lesions. Okay, some lumps, fluid filled lumps over the tummy regions, quite tense. Okay, so it's how can I tell you that it's just some oval or round lumps,
And
fluid filled.
the fluid is clear or pus or blood like?
I think it's quite clear, doctor.
And do you have any stains, skin stains around your lesion?
No, doctor.
And how would be
Uh,
the size of the lesion?
well, actually, skin change. I mean that there is some redness around the areas. That is what I have seen. Some of these rashes have broken down, but not all, because these are very tense and sometimes painful and very much itchy. Okay,
And what is the size of this rash?
these are very variable sizes, doctor. Not all are same sizes. Okay.
Okay. And when this burst out, have you noticed that you get any ulceration over the area?
Uh, I think there's some skin is sometimes some I think some uh, crusting. I think in the skin. Okay,
Any scar happened there area?
scar.
Yes, after it burst out.
I haven't noticed, doctor.
Does it
Very
move?
few have burst out, doctor. Usually they are not bursting out.
And does it move?
What do you mean, doctor? It's very tense. It doesn't move actually.
Okay. And can you tell me that how much the number could be?
I think it's around 8 to 10.
And is it increasing progressively?
Yes, doctor. I think it's increasing.
And you say that you have pain over there. You pain all over all the time, or just when you press it?
Doctor, I think it's quite painful all the time, doctor. And I usually don't press it. I feel quite pain.
And have you noticed any other rash anywhere in your body?
No, doctor.
Any skin change anywhere in your body?
No.
And any rash into your mouth?
No rash in my mouth,
Any
doctor.
soreness in your mouth?
No.
Okay. And any of your family members or friends have this type of rash recently?
No, doctor. I have not noticed.
Do you have any fever?
No.
Have you noticed anything that makes the rash worse, like makes it getting bigger or increase the number?
No, doctor, actually, I cannot notice anything, doctor. That's why I'm very much disappointed.
Sorry to hear that. And do you have any headache?
No,
Any changes in your vision?
no,
Any changes in your color of eyes?
no, doctor.
Any rash on your face?
No,
And you said that you have no ulcer on your mouth. And how about your appetite?
it's good, doctor.
And your weight?
Good.
Have you noticed any changes in your weight?
No, doctor.
Any hot or cold preferences?
No,
Do you have any fever?
no, doctor. No fever.
Any night sweat?
No,
Any cough?
no, doctor.
Any shortness of breath?
No,
Any racing or pacing of your heart?
no,
Any chest pain?
no, doctor.
Any lumps or bumps anywhere in your body?
No.
And you said that you have some bowel problem. Can you tell me more about that?
Well, doctor, I think I have been some problem that for the last 1 month, I think I have been having some bowel problem, and I have been having some loose motion, sometimes constipation. Okay, and I have also noticed some blood in my stool.
Is it frank blood or just red blood
I think, doctor, it's frank blood.
mixed with stool?
Yes, doctor. I think mixed with stool, doctor.
Any pain in your tummy?
Yes, doctor. Sometimes I feel some cramping pain in my tummy.
Okay. And how many times you pass your bowel a day?
Uh, it's not actually specific, doctor. Sometimes 1 week. 1 week, I think I have been having constipation only 2 to 3 times per week, and then after some week I feels that I have been having more bowel movement. So I'm not quite sure about it.
Okay, that's not a problem. And do you have you noticed anything comes out through your back passes?
No, doctor, I haven't noticed.
And what about water work?
It's quite okay, doctor.
Any weakness at any side of your body?
I haven't noticed, doctor.
Have you noticed any changes in the color of your hands or fingers?
No, doctor.
Any nail change?
No,
Any soreness on your palm?
no,
On your sole?
no, doctor.
Any joint pain?
No,
Do you have any past medical disease that you would like to share?
no, doctor. No pulse medical history, I think.
And are you taking any medication?
No, doctor. No medication. Sometimes I just take. I've been taking some. Uh, I think some creams, but it has not worked at all.
Any over-the-counter medication?
No,
Any herbal products?
no,
Okay. And do you have any allergy to any medication?
no, doctor.
Okay. And do you or any of your family member have this type of condition?
No, doctor. I
A-
haven't noticed it.
Any disease that runs in your family?
No,
Okay. And did you ever had any jaundice?
doctor. It was actually 10 years back. I had one episode of jaundice, and actually I went uh, to a picnic with my friends, and many of my friends got jaundice, and it stayed for 1 week, and then it went away.
Did you get any medical treatment that time?
Normal medical treatment, doctor. Some, I think, some vomiting medication, and that's all.
I am going to ask you a few personal questions. Is that okay for you?
Yes,
Do you smoke cigarette?
doctor. Yes.
I think your condition is related to your smoking, so I would like to recommend you stop smoking totally. And if you need help, I can refer you to the smoking cessation clinic. Is that okay?
Okay, doctor.
Do you drink alcohol?
Yes, doctor. Yes.
And do you know the social limit?
I know, doctor, but at times I think I cross that limit. Very rarely, but sometimes I cross, I think.
In that case, I would also recommend stop drinking. And if you need help, I can refer you to the alcohol cessation clinic. Okay.
Okay, doctor.
And may I know that what do you do for living?
Doctor, I'm a school teacher. I
Okay. And do you think that you need any social
I
support?
was a school teacher, doctor. Now I am on pension. I think I'm quite well, doctor.
And do you think that you need any support, social support from us?
Doctor.
Okay. And whom do you live with?
I will live with my children.
Okay. And may I know that I am sorry to ask, but have you ever taken any medication on your blood through your blood cell or any IV drugs?
No, doctor.
And may I know that what is your concern? 2 minutes remaining.
Well, doctor, what's causing this? Actually, I'm very much troubled.
As per I have taken your history, I need to examine it, then I could give you the best explanation. And as I have taken your history, I think you have a condition that we call bullous pemphigoid. Don't bother by this term. And in this condition, some fluid filled lesion appear and they spread over the body. And for this, we need you to admit you and give you some steroid medication.
Okay.
Do you get it?
Okay, doctor, will I be cured? In steroid is a dangerous medication. Many people have told me. And in this age, will it be good?
Okay. Actually, we will take opinion from the skin doctors, and we will give you that what is best medication for you. And this I will discuss about steroid medication later. And as we are giving you this medication for a short time, so that this will not bring any problem. We hope.
Okay, doctor, anything for the pain, doctor? Can you help me
Yeah.
with it?
Yes, doc. Yes, I am going. I am also going to give you some medication, painkiller medication.
And doctor, another thing, is that related to my bowel condition?
Okay. Actually, I am not quite sure at this point, and I will need to take opinion that if it is related to your bowel condition or not.
Okay. But okay, I'm a bit still worried, doctor, whether I'll be cured or not. I'm not sure. But that's all right. You have helped me a lot.
So, do you have any other question?
No, doctor.
Okay. Thank you.
Okay. Okay, so what do you think your main diagnosis is?
My probable diagnosis is bullous pemphigoid. My other differential is pemphigus vulgaris, and also other causing of bullous lesion. I cannot remember those.
Okay, and what can be the main etiology here? If you think it's pemphigoid, bullous pemphigoid.
Okay, as it is a autoimmune condition, so I am not quite sure that.
Yes, so that's what I wanted to know. It's an autoimmune condition, and what is the treatment?
For treatment, is main treatment is admission and intravenous steroid, and also he may needs plasma exchange.
Okay, and Can you think of other conditions that can cause this type of blistering rash?
Just pemphigus vulgaris. Then I have sometimes pemphigus foliaceus. I cannot remember.
I think dermatitis herpetiformis
Yes,
can be involved.
dermatitis herpetiformis.
Yeah, even lichen planus can be involved. These are all immunological. Sometimes genetic epidermolysis bullosa,
Yes.
and some inflammatory conditions can also be involved. Even physically, like chemicals, burns, heat.
Yes, yes.
This also
I should have asked about that if he had got any.
radioactive. I think radioactive exposure can also be involved, might be. And another thing I think very important is Porphyria cutinea tarda. And for this, you have actually asked well. For this, usually it can be associated with liver conditions. Okay, hemochromatosis, alcohol. I actually told you about alcohol, so I think you could have brought it in the DD, Porphyria cutinea tarda, because I had told you about alcohol. So actually,
I thought that Porphyria cutinea would be associated with any liver condition.
Yeah, it can associate with liver condition. I told you that only as one episode of jaundice, so you actually explained that well. But for DD purpose, I think you could have told nothing else. Okay. And cancer can also be associated with this, and you have excluded that very well by asking about any fever, weight loss, other things like that. And so I think that more or less it was a very good performance. Okay.
Okay.
So thank you, I think.